benefits of chronic care management, remote patient monitoring have been immense, and all I can tell you is it has benefited our patients tremendously. And we had launched it in February, not knowing COVID-19 was around the corner. And all I can tell you is it has taken the load off of my staff in some ways, that we were able to take care of our patients remotely by taking care of the management in them, especially patients with congestive heart failure, hypertension. And I really felt that this was the perfect opportunity for us to connect with our patients when they were unable to reach out to us, they couldn't travel to us, and we still were able to provide them with awesome care and take care of them, and most importantly, prevent hospitalizations. And to me, that was the biggest benefit. Typically, in a cardiology practice, we have a lot of patients with congestive heart failure, coronary artery disease, atrial fibrillation, labile hypertension. And these are 4 or 5 disease processes, and they all have 2 or more comorbidities. And such patients where we are already making all these phone calls. So the thing was that we were already doing all these things, but never captured. We just write it on the phone encounter. Obviously, never billed any patient for any of these. I've now been in practice for 28 years, and we have provided phenomenal care to all our patients. But this platform gave us a way of documentation where we were able to document really well. Patients were very open to us, and when they participated and they enrolled, they were very openly communicating with us, measuring their blood pressure, weights, especially with patients with congestive heart failure, hypertension. It becomes a very good way of keeping a close eye on the patients, and they see the benefit. By doing so, I believe we are avoiding hospitalization, and if necessary, we bring them into the office, we do convert them to televisits. Their labs are abnormal, we are communicating with them directly. And not only that, by documenting this software, which is documents so well, with automatically calculating the time that we are spending time with the patients and everything, and documenting labs. And we are on top of it, we are getting reimbursed for that also, which is nice. And in a way, it's helpful for the patients, and then we get appropriately reimbursed for the care that we are providing to patients. We started the first patient around beginning of February, and around mid-March, when things closed down, this helped us get through, and then our enrollment went up significantly up. And in the beginning, it was a little bit slow as we were beginning to understand the process, and the patients were, but with the pandemic, patients became so open to any way we could communicate with them that enrollment really took off. And I believe that currently we have 200 patients in the practice that are participating, and we have, I would say, 80 to 85% of the patients are participating really well, submitting all the data. And the beauty is that when they provide us with all these pieces of information, whether they're gaining the weight or feeling short of breath, we are communicating with them more often. I'm converting them into televisits, guiding them, adjusting their diuretics. If they're really significant abnormalities, we bring them into the office visit. So it has also, not only that, in addition to providing phenomenal care, we are catching things much earlier and sooner so they don't decompensate. I can guarantee that we have avoided so many hospitalizations. It's unreal. If it was not there, our communication line would not have been probably as great. As a result of this chronic care IQ management system, we have had phenomenal communication with the patients. And we have, during this period when the hospitalizations were, people were extremely hesitant of even being admitted to the hospital, we, in fact, by close monitoring of our patients, have prevented, I would say, potentially almost 24 hospitalizations. I mean, that's a big deal. And we have kept a very close eye and just kept closely monitoring our patients and avoided hospitalization. And patients are ecstatic, we are ecstatic, and it's a win-win situation in all directions. I think this is a phenomenal tool, an awesome platform that helps patients connect with their physicians. I believe this platform in cardiology, I really believe it is an extremely useful tool that every cardiology practice should utilize.